One of my guests is seated already. He is the former Minister of Health, Mr. Alex Segbefia. Good morning, sir.
Good morning.
It's good to have you here.
Good morning. Thank you, and good morning to your viewers as well.
Well, how do you feel on a morning like this, just generally?
I thank God for life. And it's a lovely morning, notwithstanding the behind or underlying crisis that our country is in at the moment. We continue to pray, but we also must take actions that help us in the sight of God to get out of this as soon as possible.
Yeah. As a former health minister, just share with us a little bit more, because I think that you're from where you sat before and the things you've seen, your perspective on the health condition of Ghana. If you can just share with us briefly your perspective of where we are vis-a-vis where we're going.
I think that when we came into office in 2009, right up to 2016, one of the things that was very clear to us was that we had a limping health care system. And therefore, it was important that we looked at the infrastructure closely. And that is why we embarked on mass building of health facilities right up and down the length of the country. And nobody knew what knows, but just even general health care was a problem. And that is why we thought that since you can't build everything you need, at least at a lower level where we had the chip compounds, we should put a lot of emphasis on chip compounds. And so that at least the people in the rural areas would be able to access health as well. So for us, it was access to health. That was the issue. And then we also realized that even the existing facilities were run down. And so we also embarked upon a retooling of most of the existing facilities. And unfortunately, and anytime there is a change of government, a lot of the previous government's activities are put on hold and slowed down for various reasons. I don't think that is healthy. And I think that in some ways we are seeing, we are less prepared. We would not have been ever fully, Britain is not prepared, America is not prepared, China had this headache. But we are less prepared than we would have been had we got some of these facilities on board, especially with the ICUs.
All right. You suggested that there are several reasons why this sort of tradition, as it were, keeps on happening. From where I sit, I think it's just basically one reason. It's politicking. Is it not time for us to just go beyond that?
Well, I would not disagree with you. When I did a progress, I once said that the only thing that somebody needs to put in his manifesto for health is to say that for the next 4 years, I'll finish any existing projects that are there. And at one point, it was close, just in the health sector, it was close to $500 million just to finish existing projects. So, and this is all the way from the period of Champong right through. I mean, if you look at the maternity block that was being put up in Kumasi, it's a big headache for everybody and every government that comes. But it is, when you look at the plans of what has to be done, it's a very important facility. And had we finished it, a lot of the problems in the area of maternity would have been dealt with in the Kumasi metropolitan area. So it is a real problem.
Okay. Right. Let's begin our conversation this morning. And coronavirus pandemic, declared nationwide lockdown now. This is the GMA speaking. Let me quickly read that story to you, give us some context for us to have the conversation. This is on citynewsroom.com. Declare nationwide lockdown now, GMA says the government. The Ghana Medical Association is calling on the government to declare a nationwide lockdown with immediate effect. The GMA, however, said the lockdown should exempt essential service providers. And I'm quoting, the GMA, fully conscious of the threat posed by this pandemic, the disturbing trend of community spread, and the obvious inadequate capacity of the nation's health system to deal with the increased numbers of COVID-19 infection, especially in the severe to critical cases, call on His Excellency, the President of the Republic of Ghana, to declare a nationwide lockdown with the exception of essential services with immediate effect. The statement from GMA says, it further urged Ghanaians to support the decision should government adopt the suggestion. The lockdown, though not a comfortable decision for leadership and citizens alike, is a proven option backed by science and along with other measures will ultimately be in our best interest. We call on all Ghanaians to support such a move in the national interest to save our nation from devastating effects of this pandemic. What are your thoughts?
The first thing I say is, what is your definition, or what are people's definition of a lockdown? And the word lockdown is being given varied interpretations.
Yeah.
So when people talk of total lockdown, total lockdown could include a curfew.
Yes.
So what do they mean?
Actually, I think it does.
Well, so what exactly are we saying when we say lockdown? The Wuhan type lockdown, which is 24/7 type scenario, it's not what is happening in the States.
No.
It's not what happened in the UK.
In the UK either. Yeah.
It's not what is happening in South Africa. So I think that don't instill panic and fear when you talk about total lockdown without defining what it is that you're trying to do. I prefer to say that there has to be structured, humane procedures introduced to help us stem the tide. The aim being, you don't want people moving around. You have to take into account that, as we said in our the committee's inaugural press soiree, you've got to take into account that not everybody has access to toilets in their premises. A lot of people still use external means of convenience, even for bathing or bathing. You also then have issues with regard to people don't stock food for 3 days, let alone a week or 2 weeks.
Not everybody has a fridge or a freezer.
Exactly. So you have to have a humane face to any measures you take to actually implement it. But if you do not do something different and more drastic now, you are going to be compelled by virtue of the nature of what this illness does and what others have gone through. You will do worse when you don't do it now. And as far as some of us are concerned, it is not that the government is not doing anything. We just think that they are always late in doing what they need to do. So they need to actually have been doing this already. Because they always say first fool is not a fool. But the second one, you have to ask yourself questions.
It's your fault.
And there are people, countries got this before we got where we are. So you look at their experiences, what happens, you take your circumstances, and then you take measures that fit into it as soon as possible. The lockdown of our ports, Ghana is on lockdown. Nobody can come in, nobody can go out, technically, by air.
So there's a form of a lockdown.
Of some sort. Ghana is on lockdown. It came late. The disease was always going to be imported.
True.
Always. It wasn't in town. So if you had closed our borders, the moment you realized that it was coming from abroad, especially since you know that actually in Africa there are very few countries whose health systems can do anything about it when it hits them, you had to have been draconian early. If those ports were closed a week before, 2 weeks before, maybe we wouldn't have seen the numbers that we are beginning to realize. What is even more frightening is that we were only testing people who had symptoms. Then, quite rightly, somebody said, okay, we are going to close the ports, but these last flights that have come, quarantine all of them, let's test them. Frightening revelation. Because in the first 180 or something that were done, we had 25 who were positive. So you then ask yourself, all the flights that have come in, even if you say 10 for each flight, and these people are all walking around Ghana at the moment, what exactly are we sitting on? Because they are happily spreading and going to functions and dealing with issues. So we are all vulnerable. And so it is not that the measures are not good or difficult, but sometimes in leadership you have to bite the bullet. And in politics you have the ability always, when you're a politician, to make, anytime a problem or a question is put to you, you make the decision based on 3 items. One is personal interest, 2 is party political interest, and 3 is national interest. And in a situation like this, the national interest must always come first. Unfortunately, somehow, as you look at what is happening, you don't get the feeling always, in inverted commas, that that is the position. And a clear example is, I always say, one phone call to the NIA to show that you mean business and say, no, this thing can spread. We don't need even one person getting it. Stop registration. You don't wait for people to shout, and then somebody has to go to court to stop it. And then even the Attorney General is saying, we are going to lift it. I mean, hello, where's your priority? You understand where I'm coming from? So these are the type of measures you have to take. And sometimes doing something in the national interest hurts you politically. But that is why you were made the leaders. You've got to make sure that you always think of us first. And come and explain it. Some people will buy it, some people won't. But always think of the nation first. And that is why sometimes, I say, not always, we feel that the delays and the lacking is because as people are looking at the issues, they sometimes mix the political issues with the national issues.
Well, I'm looking at what government has done so far. Where do you see, I know you're saying that draconian measures earlier will forestall the need for even more draconian measures later.
Yes.
But which specific areas would you pick at and say there are lapses here and there, and given, if you were the decision maker, what would you have done in that case, in those cases?
It's very difficult to say exactly because one doesn't have all the data which government has. But to start with, one would have thought that we should have shut down government agencies. If you say that, look, with the exception of skeleton staff to deal with specific areas, everybody in government institutions, except those in the area of clinical work, should stay home. Anybody who is in private practice who can work from home should stay home. It should be made clear that stay home. Less movement. You have issues with regard to the fact that you have to keep your chemist open. You have to have people giving us the news, what is happening. People have to travel to and fro. So you've got to look at those aspects. Is this the time to look at, like you look at the rest of the world, if earlier you had shut down the flights coming in, it would have been less. They are in now. Do you shut down Accra and Kumasi? Because that is where the whole thing seems to be coming from. You wait a little bit longer, then you have to shut down the whole Ghana. So the question is, those who have the detail and the fact have to look at the measures. This use of the word lockdown, you see I'm using the word shutdown as opposed to the use of, creates some level of anxiety. And people sell food on one day. At the end of the day, they have their capital. the proceeds are used to buy food for the family the next day. If they are not able to come out and they are locked up, how do they then survive? Because they don't have. So what measures are going to be put in place, especially for our most vulnerable people? These are the hard questions for government. But if you don't look after them and slow the movement down now, you will do something worse later, 2-3 weeks down the line.
Okay. All right. Fantastic. Let's get into the next story. So we want to talk about the EC's suspension of the registration that is pending. Let me quickly read that story to you, and then we'll talk about it. EC suspends upcoming voters registration exercise. The Electoral Commission has suspended its planned compilation of a new voters register because of the novel coronavirus pandemic. It was initially scheduled for April 18th, 2020, but no new date has been announced. Speaking to journalists after an inter-party advisory committee meeting on Wednesday, the EC's Director of Electoral Services, Dr. Kwaku, said the commission is collaborating with health experts to decide on a more favorable date, depending on the prevalence rate of the virus. We had planned, and I quote, to do the registration on the 18th of April, but because of the pandemic, we can't do it on the 18th. So we are observing what is happening around Ghana and the global issue, Mr. Kwaku said to the press. The announcement was expected following earlier comments made by the General Secretary of the governing MPP, John Boadu, after the meeting on Wednesday. After the meeting on Wednesday. He said that the date for the registration was likely to change depending on how it goes, as the handling of the viral infection. His comments also came after the EC said it would announce a new date for the compilation of the new register. Currently, he said, the commission is feverishly putting in place its plans. The software for the new register is almost ready. They, the EC, are waiting for the hardware, he added, and so on. Now, I understand that. Okay, so let me just go down here and read. It says opposition to the new register. The move for the new register has been met with opposition from key political stakeholders, including the main opposition, National Democratic Congress. The opposition party called on Ghanaians to reject the EC's plans because it felt the commission was yet to present a compelling argument for the compilation of a new register. All right. So you're basically saying, as a party, that the truth is that it's nothing to do with the coronavirus. Is that the case?
We haven't changed our position. Our position has always been that there isn't sufficient time for the EC, with or without the coronavirus, to have done what they wanted to do. That has always been our position. So the fact that now it's even made it worse does not run away from the fact that our position had always been that, based on the timing, based on what the EC needed to do, this was a fait accompli in terms of its non-viability.
I see.
We do not think it can be done properly in the space of time that was left. The last time we did something like this, we had done all the procurement and all the contracts and everything in 2011 before we started registering people in 2012. We haven't even finished the procurement and getting the machinery in 2020. And we are hoping to. And when we did it in 2012, we had a lot of problems because we're now using new machines for the first time. Batteries failed on us, etc. People couldn't vote on the day of election. They had to be allowed to vote the following day and some subsequently. So even then, when we had more time, there were problems.
With no COVID-19.
With no COVID-19. So we have always said, this is nothing new, that this cannot work. So if COVID-19 has come, and you try to place it simply on COVID-19, all the NDC is saying that it's a convenient excuse I welcome it because the EC has done what the NIA should have done already. They should have said, we are suspending all activities. So if the EC, who have not even started the registration, which is in April 18th, have been good enough to see that, look, because of the activities they are going to suspend, what business does the NIA have still even trying to go to court to, using a Govt to overturn it? It's absolutely ridiculous. So for me, the EC's decision is right. If they want to use COVID-19 as their excuse, fair enough. All we are saying is that the word suspension should have been qualified, and they should have used this opportunity to say that we are going back to use the old system because we have suspended it. If we try to now do it even later than was planned, we are going to have a problem. Let us call a spade a spade.
Okay. All right, so with that, we're going to take a short break. We'll be right back. I'll introduce my other guest to you, and we'll continue the conversation. Please don't go anywhere. All right, welcome back from that break. This is Breakfast Daily. This is the news review segment on Breakfast Daily. We have a few messages for you from the viewers, so let me just read a few of them, and then I'll introduce my guest to you. All right, so Babamu from Tamale Central says, government's efforts in fighting this COVID-19 pandemic so far has been superb. However, I totally disagree with GMA for calling government to lock down. This is because this is going to create fear and panic. Moreover, we can't compare ourselves to the developed nations like US, Italy, Spain, and many more. We should rather intensify prayers from this viral infection. Indeed, the move by EC to suspend all activities because of coronavirus is also a step in the right direction. Hashtag spread calm, not fear. All right, thank you for that. Ayu Farouk from Tamale North says, good morning. Yes, lockdown is necessary to prevent the spread from getting far, but many measures need to be put in place as well. Hashtag Breakfast Daily. Se Ewuku from Esuboy says, God is in control as well as government making sure its citizens are safe. Let's not fear or panic. Rather stay home and follow the protocols of WHO to ensure the safety of our loved ones as well. The EC's decision to postpone the voters' register is welcome. Ghana shall overcome this one too. All right, and he also says, spread calm, not fear. Let's spread calm and not fear, for the government is on top of issues. Nevertheless, there is more room for improvement. This is OP from Esikado Ketan. All right. Now, my other guest is in studio. I'm just going to introduce him to us, and then we will continue the conversation. So, because we didn't have him give us a contribution on the earlier topics that we did, we're going to have him just make his comments there, particularly because I think he's still a member of the GMA. I don't know if he's moved on to other things, but very good friend of mine, Dr.
Still a member of the GMA.
You're still involved with the GMA? Okay, right, here he is. Dr. Nana Ayew Afriyie. He's also the MP for Effiduase-Asokore and the Vice Chairman of the Health Committee of Parliament. Good morning.
Good morning.
How are you doing?
I'm good, and you?
I'm very well, thank you. It's good to see you after all these years.
Very well.
I didn't imagine that we'll be sitting here together on the same set. Yes. So earlier on, we were talking about the GMA calling for an immediate lockdown, nationwide lockdown. What's your take on this?
A very good morning to your cherished listeners. I'm still a member of the GMA, and absolutely so, I'm also representing my constituency in Parliament. I welcome the position of the GMA But I would also want to come from my point of view that what reasons did they state for the basis of the lockdown? Yes, because you and myself understand that in public health emergencies, there are stepwise approach. And then also in complex emergencies, as a public health person myself or health economist, definitely you would have to make decisions, bearing in mind that there's cost to every decision and there's a social benefit as well.
Yeah.
If you go to WHO, who are in the forefront in terms of giving advice on countries' approach to this, WHO clearly has given guidelines. And there is research evidence to back from China, from France, again in China. And even so, yesterday, the National Institute of Allergy and Infectious Diseases, director, their position is so clear that social distancing and the preventive measures are the way that, according to the literature, can reduce 97.6% of infectivity and reduce mortality by over 90%. If there is any evidence to the point that complete lockdown, at this point that you have about probably, I don't know, as of yesterday, it was 68 cases. About 30 were within the population, and about 38 were those who were compulsorily quarantined. I am of the strongest of position that in as much as we have understood data and analysis, clearly we don't have to panic because we expect increases because there have been exposures. We have experienced increases at a decreasing rate, not extremely alarming like it is with some other epicenters. We expect that the technical people who are on the ground would give day in and out information that would have to be processed without panicking and taking into consideration that the larger population of Ghanaians should come through this pandemic alive. Looking at the GMA position, that I say that their position is welcomed vis-a-vis the current literature, I am of the strongest position that going for lockdown is going to be a hasty decision.
Okay. Now, what Mr. Segbefia said earlier on was that the decisions that we are taking, if we don't take certain drastic decisions earlier, in the process, we will end up being forced to take much more draconian decisions later on, And so, of course, it is within the remit of the experts.
There's that possibility.
Yes.
In analysis, clearly, you look at all the sides because you will have to look into the future. That's what we call futuristic analysis in public policy. So obviously, that is one that you would have to put on the table. His thinking cannot be wrong. It could be in analysis. In the same side, it is also of the other angle where you have a situation at stake. All public health physicians listening to me, in epidemics or in pandemics, identify the index cases or you circle around the risk groups, those who have had direct or indirect contacts as the tracing teams are doing. Obviously, the epidemiology trend of this viral infection also brings some literature that when you get infected, if 10 people do get infected, 8 of them is mild. And of the mild one, there is about 95% recovery in all of them. And there will be some 20% who proceed, and then it could be that about 2% or 3% of them, there's a case mortality. So therefore, if you have this understanding, it presupposes that some people among us would have been exposed already, but then you have it asymptomatically, and also it will show as if you had just a mild flu, built antibodies, and therefore you are going about your normal duties, but you have been exposed and you are okay. The situation is not as if when you have it, then you go in. That is why some people got it, and on the 6th and 7th day, when they tested it, it was negative.
Okay. Let me bring what you're saying into context with the Italy experience, the US experience. Let's not even talk about China now.
UK.
Let's look at UK, US, and Italy experience.
Good.
Right. Their healthcare systems are incredibly more robust than ours. Right. Now, they are under strain and pressure right now because the intensive care numbers are increasing. Right. Do we have what it takes to allow the system to slowly plod on and maybe get to that state? Or you don't think we will get there?
Developing countries don't have that robust health system.
Yes.
Developing countries.
True.
We don't. And we should not even think that Ghana has what it takes, because even in the rich countries, they are so much overwhelmed.
So shouldn't we take measures now, more drastic measures now, to prevent us from getting there?
Have you also asked yourself why the rate of infection is not as sporadic and moving as the penetration of the virus in the community is not as fast as it's also happening in the
we are barely 2 weeks into the infection since our first case.
Yes, but you had a case of other countries where barely about 2 weeks to 4 weeks. Then you have several huge numbers of reported positive cases.
Maybe also we are not testing.
So I think that my position clear is that you have to shut the borders like the president has done, which is very positive, telling us that a lot of the cases are imported cases. I think that we would have to increase the rapid testing kits if it's available and it's gone to FDA. We should start using it by circling all those who are at risk of having the infections.
Noguchi says rapid testing is not the way to go.
So what Noguchi says is not the way to go.
The rapid testing.
Why is it not the way to go?
He says that we don't have enough. He says we don't. This was the director of Noguchi. He says we don't have enough experience within our system with this condition, with this viral infection.
But which country has that experience? Nobody.
Okay.
Not even China. Nobody has it. Mm-hmm. So that sort of English should go out of the way. I mean, clearly, we're talking about reality, where US is doing about 3 million, UK is doing over 4 million kits. Everybody is working into kits. So you can circle the risk groups, health workers, immigration people, contact tracing, all those sort of people who have been exposed, encourage home test staff, and at the end of the day, you are telling me that rapid testing is not the way to go. It is a way. It's actually, there's a literature that backs that in complex emergencies, you use rapid testing. And so I think that then Noguchi boss will have to come back again. I mean, he can't write his own book. You understand? I mean, the position is clear. In complex emergencies, you have to use rapid testing. It is indicated. It is part of it. Otherwise, what do you expect people to do? Referral laboratories to take care of outbreaks? It doesn't work like that. Except there's no solution. Rapid testing is cardinal. It's part of the literature.
Okay, so you're saying that if we have home test kits or rapid test kits and so on, people can test. If they find themselves positive, then they report themselves. Is that what will happen? Is that a scenario?
Absolutely. It would encourage people who have had exposures. It might be the case that the positives would go up. Mm-hmm. But it might be the case that after 7 days, when you test again, it will be negative. Because regardless of it, there's another study that says that if there is one death, it means there's 1,000 infections.
I see.
Yes. So if there's 3 deaths, it's about 3,000 infections.
So you have hope?
I have the strongest of hope. Because complete shutdown. Look at the countries, I'm sure we'll go there. Those who have shut down. So that we'll know the issues that is emerging now since yesterday in those countries. I'll be very happy that we'll look at the economics of it as well. Health is wealth. Wealth is health. It is what it is.
Yeah. And you had wanted to say something.
Yes, I was just going to say that one of the things that goes with the issue of what numbers we are dealing with is dependent on what testing you are doing. Even though we are not doing any form of random testing.
No.
All the tests we are doing are geared towards people who show symptoms.
Yeah.
Except for the people who were quarantined. And the statistics of that quarantine are frightening. Because all of a sudden you had 25 people stepping off a plane. So it's good he's mentioned that, look, potentially if you have 4 deaths, you're looking at 4,000 potentially infected people.
Yeah.
And that is not necessarily a good statistic because we do not have a robust health system. Our fatality rate may be worse than in other countries. And so when you talk about figures, but it is not backed by the testing you are doing, you have to be alive to the fact that actually a lot more people are walking around with this disease. I also think that because he wasn't here, he didn't hear the point I made about the type of lockdown. Because lockdown, when people talk of lockdown, doesn't mean we are now in Wahun type scenario where you couldn't open your front door. They will come and give you whatever you need. It's not the same in Britain. It's not the same in the States. But restriction of movement based on your circumstances has been, because what social distancing...
It's a form of enforcing social distancing.
Exactly. That is it. So they must be looking, as a government, at what steps they have to take. And I've said that the steps that have been taken are good. Some of our issues are with regard to timing. And yes, we have all the social issues. Kaya sleep in the street. If you say people should stay indoors, where are they going to stay? Have we thought about whether we have to open dormitories in schools which are closed down to let people sleep in them in this period, etc., etc.? These are government issues, and they talk to the MCs and the DCs. They will give them the details and the statistics in each area.
Okay.
But without looking at those and dealing with it as soon as, we will have a difficulty, and we will deal with it. The steps we will take subsequently will be worse.
Okay. All right. Let me just get your quick comment also on the EC suspending the voter registration exercise. We talked about it earlier on. The EC says that because of the novel coronavirus pandemic situation as we find ourselves, they've decided that, look, 18th April, things will probably would have ratcheted up a bit more, and so they're suspending for now. The NDC says, and Asidun Ketia is quoted to have said that it's not true. It's not because of, it says EC is using COVID-19 as a cover-up. Equipment for registration is what is the real reason that it's not ready, and that's why. What are your thoughts as to what's happening?
I will go by the position of the EC. I mean, if in the midst of the pandemic, they think that queuing, or by the time they will hold a process that's in April, well, probably they will not be able to adhere to the principle of social distancing. If they still think that they cannot be able to adhere with that, then, and that to me is the novel approach among all of them. So if they have weighed themselves and they can't, so be it. They did not say they won't do it again.
No.
They say they will postpone it. So the issue of procurement, whether it will come now or will come later, I mean, regardless, it will come anyway. So if they did not say they will stop it and they say they will postpone it, it's fair. It's fair.
All right, there's a side question, by the way, that I have. I understand that a lot of the MPs in the House are wearing N95s. Is that true? And
yeah, it is true.
It's true. Why N95s for MPs, though? I don't understand that. These are respirators, and I mean, health workers need them.
So you are panicking, and you are panicking, and therefore I'm sure the MPs too are human beings. They can panic as well.
I'm not
so
panicking.
When we get to the chamber, we get to the chamber, and I'm not using it. I'm not using me. I folded mine, So that's I'm not telling a lie about it. I just folded mine. And then Dr. Nwama Brekum is not using it, and Sandari and he's not using it. They say, how about you, the doctors? You are not using it. But the point is that, I mean, what literature is making it look as if there's going to be spread airborne and stuff like that. So, I mean, causing fair panic, So I don't use it.
Okay.
Yes, I don't use it.
All right. Okay. Let's quickly go.
But you use a mask.
Sorry.
But you use a mask.
No, they give mine to me. I get into the area. I wash my hands, well sanitized. I get in there. There's real social distancing. I sit, I do my work, and then I leave.
What's the smallest distance between any MP in the House?
Oh, I'm
Just
sure the
sense.
pictures on social media. You saw one here. I saw one. It is what it is here. Chronicle.
Okay.
It is what it is here.
So probably like two seats apart?
I'm sure they are even panicking more than usual. It's maybe more than 2 meters. I was saying that on the business statement of Friday, I was going to ask Speaker, Mr. Speaker, I'm sure the issue of attendance, we should stop signing attendance so that naturally some will be at home and there will be enough social distancing.
But is it not correct
chamber.
that the Wuhan literature is that facial masks are good insofar as when you use a facial mask, if you have it,
yes,
then it is difficult for you to spread it.
Yes, if you have it.
Yeah.
Yes.
And also it is indicated for health workers who see upper respiratory tract, who see cases, not even the customer service people, those who are in the consulting room, who are seeing
Directly
cases. Because some cases will be mixed up cases. It will be normal asthma, cough, normal upper respiratory tract infection. So it's not indicated for everybody to
But no, I
use.
beg to differ.
Yeah.
And my is that if you are doing mass testing,
Yeah.
then I think your position is perfect. Because you are testing people, and people, you can tell whether somebody has got it or would have had it. But if I don't know whether I have it, and I will not know till I show symptoms, you don't know whether you have it.
Right.
He does not know.
Yeah.
So we could be spreading.
Yes.
Therefore, if we are wearing the mask,
Yeah.
it protects all of us.
So no.
You understand what I'm saying? Because I cannot spread it.
I was going to say something.
Yes.
You go ahead.
No. I don't think that is the case where, because indirectly some asymptomatic persons are there, and therefore if we all wear it at any point in time, it would
in public settings. I'm not saying
yes, but if you are keeping to the principle of, I like that in public settings.
Yes.
We are keeping to the principle of social distancing. Where would the droplets come from? So at the end of the day, I mean, if I put the mask on me and I know clearly that I don't come closer to you and there cannot be any droplets on me and there's no evidence of it being airborne, so why would I create fear and panic at any point? Then I will be driving in town, I'll be walking in town, and I'll have to put my
have you seen a
mask on.
parliamentarian who has stood up in Parliament and talked softly?
Okay, well.
Your social distancing should be even about 3 meters.
That's why I'm saying that naturally, if you go to the chamber, the laws of nature is applying. Some people are not coming.
But that's not
so at the end of the day, there's sufficient space among us.
Okay.
Well,
yes.
All right, let's do the last story real quick. Government may introduce restrictions, further restrictions, says Opong Nkrumah. Let me just quickly read that for you. The Minister for Information, Kojo Opong Nkrumah, has given indications that the government may announce restrictions in some parts of Ghana as a part of additional measures to stop the spread of coronavirus in the country. He said a restriction or any other new precautionary measure the government may adopt will be aimed at curbing a community spread of the disease. A minister in a Citi News interview said the government has taken a number of proactive steps in dealing with COVID-19, and the passage of the imposition of restrictions law will give the government room to step up its measures. So far, every step of the way, the government has been very proactive with coming up with measures to contain the situation. Those final rafts of measures, now that the law has been put in place, may include some restrictions in some parts of the country, but whatever will be done will be with the objective of ensuring that we totally negate the potential for community spread. Well, let me start with you, Doc. So far, we have 68 confirmed cases. Restrictions. I know you're saying that we don't have too much to panic about yet, but what are some of the measures that we can be expecting from government in the coming days?
Yes, I expect continuous enforcement of the closure of the borders, compulsory quarantine to all Ghanaians and work permit or residents who arrive. I expect that, obviously...
Were we still allowing flights to come in?
I think that there's been some high commissions that have done some arrangements to take their citizens and co. So I'm sure there's some. Yes, and then also I look at all those who are exposed directly or indirectly, like I said, that we can have the RDTs to be able to test all of them. If we are able to give a lot of confidence to health workers in this difficult period by doing regular testing on them, because you have the RTTs, is also very helpful. Increase awareness and education is also very important for us. The transport people having a deal with the trotro people is also good, because ordinarily it will not be easy if not for good talking. They wouldn't allow, they would definitely be protesting. But I'm sure they've seen the sense to keep faith to the principle or the understanding that they have. The local government also should be ensuring that the DCs and the MCs, wherever they are making sure that there is a sufficient social distancing in some areas, having a task force that sees to it, sufficient Veronica buckets, and also sanitizers in. Now, health workers, there should be a possibility that we should have drive-thrus when they have the RDTs. They have drive-thrus like they did in South Korea, where you have, like in every region, a certain tent or a makeshift structure that people who feel have been exposed, because not everybody should go there, but people who feel, and then they have a checklist of some indicators that shows that you have directly or indirectly come in contact. So you can drive through and get checked as well, so that they can have this drive-thrus in there. That also should be possible. Now, I also foresee where, regardless of the technical people's position, if indeed the masses, the voice of the, or maybe if we don't get people to understand that of the possible 3,000, because if there are 3 or 4 deaths, the possible 3,000 or 4,000, there are about 80% of them who definitely will be just walking there, no problem. And there will be about some 300-400 of them who proceed to positive stuff. And then there will definitely be coming, and there will be increases in the reported cases. Because if you look at 68 as of yesterday, that was out of about less than 850 people who are quarantined. They are going to 1,000 and about 30 or 1,050. So I anticipate by the time they will hit 1,030, obviously some 80 or 84.
Okay.
But then we save because they are still compulsorily being quarantined. And then I see that the PPEs that they have ordered, there's a sort of procurement difficulty. It looks like even us who run the private clinics as well, the orders we have made for even RDTs, they are telling us, that it's on my phone, which I could show to you, that a lot of people are making orders on about 2 or 3 factories globally.
I see.
So it's not easy to have your item. So if indeed we are able to get our PPEs on time, then whatever money should go into reorder levels. And then also we step out our education in terms of the taking up of the immune booster stuff.
Okay, just to keep ourselves...
Yes, keep yourself
healthy,
up and stuff like that, you know. So if we're able to do this, that will be okay. But then if people heighten it up and keep heightening it up, and TUC and all of them, and lockdown and lockdown and lockdown, then...
I'm going to have to cut you there. So, yes, please, a quick comment on this one. And then
Well, I've said that you need structured, humane measures.
Okay.
And that encompasses a lot of things that have been said to ensure that we have what's it called? The spread being slowed, or for that matter, stopped.
Okay.
And without doing it with a humane face, then the difficulties that arise from lockdowns then will begin to manifest. But I think the measures are good, but we shouldn't delay.
Okay.
And you have to know that if you want to do some measures, you have to give some notice, maybe 48 hours or so before you go into certain measures. When they wanted to stop the planes, they said, the announcement I think was made on a Friday or so, and they said on Tuesday. Yeah. But now with this type of growth rates which is happening, if we are not careful, 2 days is a long time in this business, or 3 days. So the earlier they start giving us those days, the better.
Fantastic. Thank you very much. We have so many messages coming from you out there. I can't read all the messages right now, so let me just thank my guests, Dr. Nana Ayew Afriyie, MP for Effiduase-Asokore, and also the Vice Chairman of the Health Committee of Parliament, and a former classmate as well. I might as well add that. And Alex Segbefia, who is a former Minister of Health. Thank you very much for watching this segment of the show.
Hi, I hope you enjoyed the show. Do not forget to subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.